And today's Health Hour is brought to you by CAHN, which in the video that you saw is really a collaboration with CAHN and their partners of RAFA, Croydon BME Forum, Enfield Caribbean Association, BHI, and Redeemed Christian Church of God, people that have come together to really think about how we can really empower our communities to know about our health and to advocate for ourselves and each other. And it's always such a pleasure, not only to present, but to be your host in sessions like this, because I learn so much. And we have fantastic colleagues that come online for us. And today is no exception. We have Dr. Kenny Sunmboye, and I probably said that wrong. I practiced it before. I was.
No, you said it right. You're spot on.
I was given kudos, so hopefully I maintain that. But Dr. Kenny is a consultant rheumatologist, and he will be talking to us about something that many of us may have heard the words, many of us may be affected or have a family member affected by it. So it's going to be great to hear about lupus and fibromyalgia. So as always, we hand the floor over, but as our colleague is speaking, please get your questions in the chat or get ready to answer them at the end. And then after the presentation, we'll have a great time of discussion and further reflection about what we've heard. So now I'm going to hand over to Dr. Kenny. Dr. Kenny, thank you so much for coming today.
Thank you, Vanessa, for having me. You got the name spot on. Can't argue that at all. So well done. As I was saying to Vanessa, that my dad decided to add so many consonants to my surname, so just to make life that bit more interesting. Vanessa, can you see my slide okay? Slide coming up okay?
Perfect.
Is it moving?
Moving.
All right, fantastic. So thank you everyone for having me. It's always a pleasure to have these CAHN sessions. I think it is important to always highlight on the health needs of the African and Caribbean and Afro-Caribbean community. I think it's very, very important. I'll be talking about a disease that is very, very passionate to me, more like two diseases very passionate to me. I look after these diseases in my 9-to-5 jobbing work as a rheumatologist based in the University Hospitals of Leicester. That's East Midlands for anyone struggling with local geography. Right, so again, feel free to ask me about anything at all. I'm more than happy to take any questions on whatever might be bothering you or whatever myths I can dispel or whatever I can help you gain more information on. So the outline for this session will follow what is lupus, how is it diagnosed and treated, and what patients need to know. You, the patient, either affected by lupus or you know someone that is affected by lupus, or you have a relative or friend that's affected by lupus, what you need to know. And I'll also talk about fibromyalgia, which can be a complication of lupus or can sort of mimic lupus, and it's not necessarily lupus itself, and the same format to how it's diagnosed and how it's treated and what patients need to know as well. Now, lupus is also called systemic lupus erythematosus or SLE, so you might hear your consultant or your doctor or GP using these terms interchangeably. It pretty much means the same thing. It can be used interchangeably. But a bit of history as to why it's been called lupus in the first place. Now, it's a name that was coined in the 1800s. It's lupus refers to, I mean, obviously the name lupus itself is the Latin word for wolf. And why it's called lupus is anytime people get a wolf bite, the rash that they get as a result of that wolf bite mimicked what people saw in lupus, and it's the reason why it's called lupus. And in the late 1800s, William Osler, that happens to be Canadian, he's such a big name in the British medical field, but I actually discovered that he's Canadian. He's actually not British, but he's Canadian. But he then coined the name systemic lupus erythematosus as a name when he realized that people get a very characteristic rash and many organs being affected. So very, very interesting. I always like a bit of medical history to try and enrich disease knowledge, because I think it's important that we understand where it's all coming from. So what is lupus? Essentially, lupus is a disease we call an autoimmune condition. Now, autoimmune just means that in simple terms, your immune system, which is the body's defense system, is attacking you and causing diseases. And when it does that, when your immune system, which is your body's defense system, turns on itself, it can cause disease, and that's what you need to be aware of. If I explain it in a way to allow you to, if you don't mind, if there's anybody not on mute, you can put your phones on mute, please, so you don't cause interference for others. Thank you very much. So if I explain it in simple terms for you to understand, your immune system is like your country's defense system, where you have the Air Force, the Army, and the Navy. So you can imagine a general within the Army trying to take over the country to stage a coup. That's pretty much what autoimmune diseases do. So you have a part of your immune system turning on itself and starting to shoot innocent people and its own citizens. Pretty much what's happening in Afghanistan. That's what you need to think about it, that the Taliban has taken over the country, and obviously they're absolutely ravaging the country. So that's what happens in autoimmune diseases. The immune system goes wrong, you produce proteins called autoantibodies, and it causes inflammation and swelling and damage. That's pretty much what happens in very, very simplistic terms. And that should really help to really understand what happens. Now, what causes it? Now, we don't have a cause for lupus, but we know things that are associated with lupus. We would say largely it's unknown, but we know there's a genetic link. If a mom has lupus, there's a higher chance that a daughter will have lupus. It's rare in men, but there are some men that can have lupus. Men that do get lupus, they tend to have very, very bad disease. We know environment has a big part to play with lupus. So environment such as sunlight has a part to play, external stress from work, from loss of a family member, bereavement, anything that really sort of causes significant emotional pressures can cause lupus. As an example, there's a young lady once that I saw many years back now. She went on holiday, beach holiday, to a very, very warm climate area. And she came back and had lupus, because we know sunlight can trigger the onset of lupus for those that are already prone to it. And for those that already have lupus, obviously sunlight can cause them to flare. So that's something to be aware of. Obviously, coming down with an infection can cause lupus. There have been cases of people that have had COVID infection, and that COVID infection, after it has settled, triggered lupus. Certain kinds of drugs can cause lupus. We call that drug-induced lupus. And also smoking is also something that we frown against for people that have lupus. Essentially, if you have lupus and you smoke, it's likely to give you a flare of disease. We call a flare of disease when your disease gets slightly worse. So these are things to be aware of in terms of the triggers and the underlying causes. But there's still ongoing research to try and tease out what really does cause lupus. Now, who can get it? Anyone can get lupus, but as I mentioned earlier, if a mom has lupus, there's a higher chance that a daughter can have lupus in terms of percentages. So if the offspring of a woman that has lupus are 9 times more likely to have lupus compared to general population. But we say that the prevalence of lupus in the UK is about 28 per 100,000. So it's quite a big deal if you think about it. That for every 100,000 people, you have about 28 people with disease. That's quite a significant number. But it tends to happen more in people of reproductive age. So we're looking at 15-year-olds to about 44-year-olds. You're more likely to have lupus if you're still within the reproductive age. If you are beyond that, you can still get lupus, but there's a less of a chance that you're going to get lupus. And certain races are more prone to lupus. So Africans, Afro-Caribbeans, African Americans, people of African descent, Hispanics, and South Asians, and lastly, Caucasians. So, which is why in a young African or Afro-Caribbean girl presenting with joint pains with any odd-looking rash, you have to think lupus. You really have to think lupus. And obviously, anybody with a family history of lupus, with typical symptoms of lupus, it is important to get yourself assessed just to ensure that you're not having early signs of lupus. So early recognition is very, very important, and I do have to mention it. Now, what organs are affected in lupus? Any organ can be affected in lupus. People can have brain involvement where they present with very, very severe depression, constant headaches that are not settling. When headaches become an issue in lupus, they tend to have other features, so don't panic. If you have an ongoing headache that hasn't settled, don't panic that it's lupus. There are usually other baggage you're likely to get. Skin rash, as I mentioned, typical rash on the face, on the scalp, very ugly, scarring rash that can cause problems. It can affect the blood levels and the blood counts. It can affect the lung very rarely, where people present with breathlessness. and they start to struggle, and it can present with joint pains and swelling. And in more severe cases, it can affect organs like the kidneys. An example of a celebrity of someone that has lupus that we know that we might know about. He's an African-American actor. His name is Nick Cannon. He presents, I think he was presenting America's Got Talent in the past. So Nick Cannon has lupus, and sometimes he gets really affected quite badly with the lupus. Then this singer, Selena Gomez, she also has lupus. Unfortunately, in Selena's case, lupus was so bad, it affected her kidneys and she needed a kidney transplant. The poor girl, she was on steroids during the early phase of her treatment and she started to gain weight. And the media absolutely slated her. They called her all sorts of horrible names. Fat Selena, fat pig. And unfortunately, all she was on is steroids. So it does come to show that you truly do not know what people are dealing with. And people tend to make false impressions just because they don't know the ins and outs of what you're dealing with. So lupus can be quite ravaging in terms of its effects, and it can be quite devastating. Seal, the singer, the British singer, he had the form of lupus that is confined only to skin, which is why he has the scars on his face. But obviously it appears that he never really went on to have the more damaging severe effects of the other organs being affected. Now, there are various types of lupus. There's the type that can be confined to skin. I've given an example of Seal, the British musician that sang that wonderful song, Kiss from a Rose. And there's the other type that affects the internal organs and presents in a more significant generalized way, the type that Selena Gomez has and Nick Cannon. Then there's the drug-induced type that people that take certain kinds of medication can get. The kind of medication that causes the lupus they're not very, very common drugs, so I don't want you to be too worried about that. The drugs tend to be quite niche, so I wouldn't want you to be worried about medication that you're taking that could potentially cause lupus. Then there's the what we call neonatal lupus, where mothers that have lupus can sort of transmit the antibodies to their children. We call that neonatal lupus, so that's something to be aware of, that could be another form of lupus that can arise. So what are the signs and symptoms of lupus? Now, it seems very, very important to mention that no two cases of lupus are the same. So just because you have a relative with lupus, their lupus journey is definitely going to be different from your lupus journey. Lots of people present in varying ways. Some people present with very mild disease, and some people have very nasty, severe disease. So there's no correlation as to what kind of lupus you're going to get just because a mom or a father has lupus that is quite significant in a certain way. So be very mindful of that. Now, there can be symptoms of tiredness where people complain of very extreme tiredness. There can be unexplained fever. And the only way you can tell if you have a fever is when you're very sweaty at night. So if you find yourself being sweaty at night, you're losing weight, especially if the weather is very, very cold and cool, and you're sweating at night and losing weight, something you need to be very mindful of. But I have to mention, if you're perimenopausal, if you're approaching menopause, you may have night sweats. So please be very careful not to assume that all those sorts of symptoms are due to lupus. Speak to your GP if you have any concerns, and that's something that can be made clear to you as to what's causing your symptoms. Some people get a rash on the face. The example I gave is Seal, the musician. We call it a butterfly rash when it presents like the wings of a butterfly. Some people get joint swelling, and some people get hair loss. Now, anytime I ask about hair loss, women always panic that, oh goodness, I'm losing hair. Do I have lupus? No. The sort of hair loss we worry about is when you wake up with locks of hair on your pillow, that's quite significant. Or if you're sat on the settee, on the couch, and you're losing hair, that's very significant. I don't panic when hair loss is the kind of hair loss you get in the shower, where you see clumps of hair blocking the sinkhole. That's not the kind of hair loss I'm worried about. So don't panic. It usually refers to very, very brittle hair from very little effort, just causing you to lose hair, particularly when you wake up from sleeping or you're sat down watching telly and all of a sudden there's hair everywhere. That's the sort of thing you should be quite careful about. And you can see all these symptoms can happen if you have the flu. So you have to be very, very careful not to assume that all these symptoms may be down to lupus. It's nice to speak to a health professional, as you're doing today, and I'll be able to sort of shed some light as to what can or cannot be lupus. But definitely hit us in the comments and we'll be able to at least make things clear for you within our allotted time. Now, depending on the organs that's affected, the symptoms may be different. So if you have brain involvement, some people present with confusion. If there's skin involvement, they present with very bad skin disease. If there's kidney involvement, they present with kidney issues. And if it's heart involvement, some people present with heart attacks. Yes, lupus can indeed cause heart attacks. And in fact, people with lupus, they die early. And that's the problem. That's why lupus is such a big deal to us lupologists, as we call it. Doctors that treat lupus are called lupologists. Right, so how is it diagnosed and treated? Now, it is important to mention that lupus can be quite difficult to diagnose, even for us specialists, which is why don't give your GP a hard time if they've missed your diagnosis of lupus. That can happen. But it is important that if you've been visiting your GP with the same complaints over and over again, they do need to listen to you. And sometimes GPs need a bit of guidance, very important. I find that when patients come to me to clinic with a list and they run through their list in a very structured way, it helps. Remember, we as clinicians are your guide at the side. We're not your sage on the stage. We can't tell you what to do. Ultimately, you, the patient, knows what to do. So we will be happy to be guided by you. Tell us what your symptoms are, and then we can all piece it together to actually find out what the actual issue is. But specialists can make a diagnosis based on the history you tell us when we've examined you and when we've taken into account the blood tests. Remember, just because you have an abnormal blood test doesn't make it lupus. Ultimately, you need symptoms alongside that marries up with the blood test to get diagnosis. So it's something you should be very mindful of. And what the specialist does as a rheumatologist is I take the history, your blood tests, and everything you've said, family history, if relevant, we take it into account to draw conclusions. So no one test can convincingly say someone has lupus or not. You need to take everything in its entirety to arrive at the diagnosis of lupus. Now, there are other sort of items to pay attention to that can cause lupus. Again, this is more of an academic slide. You don't need to worry about it. It just shows that lupus can be quite varied in how it manifests, from skin to joints, to heart, to brain, to kidneys. It can be quite manifest and widespread in how it can really affect the individual. So how do we treat lupus? Essentially, lupus is treated by two ways. We start off with the first level of giving steroids. For those of you that have had steroids, that's very, very common. And we give what we call therapy to calm the immune system down. So if you remember the analogy I gave about autoimmune diseases, where the issue is your immune system becomes overactive and starts to attack the individual. So say, for example, your immune system should be 100%. In lupus, your immune system starts to become overactive, hypothetically becomes like 200% and starts to attack the individual. What then happens is we give you medication to drop that overactivity from 200%. We bring it down to about 80, 90%. So it's not as aggressive and intense. The way to think about it is, if you can imagine a very naughty child in a very posh living room, and the child all of a sudden starts to smash things up, break the mirrors, smash the telly, pour ink everywhere. So the drugs we use are like the ultimate super nanny drugs to just try and calm that child down. So that's what it is. You can't kill the child because obviously the child is precious. Naughty as they are, they're precious. But imagine a very strict super nanny sitting in that room with that child to stop that child from doing anything. That's the way to think about the drugs we use in lupus. We call it immunosuppressive drugs. That's the way to think about it. So the minute you take that nanny away from that room, what happens? The child is naughty again. So for anyone of you with lupus, or if you know someone with lupus that is refusing to take their medication, if you remember the analogy I've just given, if you take that nanny away from that child, the child becomes naughty again. So it is very important. You have to take your medication because that's the only way to control lupus. If you don't take medication, there's a chance you would flare. Now, I know people get caught up with all sorts of things saying, oh, there's this person on Facebook that said they use vegetables to treat their lupus. They use this, they use that. That is not accurate because remember, everyone's lupus is different. There are people that have had mild disease and their disease is so mild that they can get away with not taking anything. Those are the kind of people that end up having YouTube channels and saying that vegetables cure their lupus. Please be very, very careful. This is science that is well proven. If you have lupus, you need to make sure you're on board with your physician and you're taking the medication you should take. Please, 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 please avoid watching someone on social media making stuff up. And you might not be aware of this, but there was this Australian blogger that she was lying for years. She had cancer, but she was lying. She just did it to get views. And all of a sudden she's been exposed. And she kept telling people she's taking vegetables and is cured of brain cancer. She's taking herbal treatments and she's cured of brain cancer, but she was lying. It was when an investigative journalist actually dug into it and said, if you have brain cancer, surely you should be dead. It's 5 years now and you're still not dead. You still look great. If anything, you look better than people with cancer. So you need to be very careful. Not everything you hear on social media is actually true. So please do bear that in mind, please. Very, very important. Now, what do you, as a patient, need to know about lupus? For those of you that have lupus or know someone with lupus, what you need to know is that, as I said earlier, diseases can be mild to severe, and it can persist. It's not this kind of condition we can cure. So be very mindful that just because you can't see disease in those individuals doesn't mean they don't have disease. You need to be empathetic towards them. And flares can come and go, and flares can be triggered by all sorts of things: stress, work stress, bereavement, disease, even COVID infection. It can cause a flare. So be very mindful. Sunlight can trigger a flare. So make sure you have your big hat on a very sunny day. Make sure you have your sunscreen on. I like a product called SunSense. It's a bit pricey, but it does a very good job. It contains a minimum of SPF 50. Slap it on so that you don't get triggers from sunlight. Weather changes can do that. So sometimes switching from summer to autumn, autumn to winter, winter to spring can cause flares of lupus. So be very mindful. Work stress I've mentioned, and if you're not compliant to medication, that can cause lupus. So please be very mindful of these things. But again, if you need more light shedding on this topic, please hit us in the comments and I'll be more than happy to take it on board. And flare symptoms can be any of the symptoms I mentioned early. So fatigue, unexplained fever, being sweaty at night, having a rash on your face or hands or anywhere else, joint pain with swelling. So remember that usually once you have joint pains and it's coming on with persistent swelling, that's usually a problem. Take a picture on your phone as evidence to log this rash or this swelling you're concerned about. Because sometimes by the time you see the consultant, the symptoms are gone. So it's nice. I always like it when people show me photos. That way I can see and say, okay, yeah, actually, this does look very suspect. That lends more information to allow us to make an informed decision for you. So please get into the habit of taking photos, particularly if you see swelling or a rash or something that's a bit suspect. Take a photo in a well-lit, bright room against a white background so that we know it's you. Try and put some identifier there. So if you have your ring, make sure you wear your ring so that we know it's you, or something so that we know it's not a picture you dug off the internet. Believe it or not, people do that, but it's the way of the world, isn't it? And hair loss. I always say if you're starting to see a woman's scalp from hair loss, then that's quite significant. And as I mentioned, if you're waking up with lots of hair on your pillow, that's also very relevant. But the general message is not everyone's lupus is the same. It can have serious impact on the quality of people's life and the enjoyment of their life. And lupus makes people more prone to disease, heart disease, diabetes because of the treatment of the condition, and also kidney disease. So please be very mindful. But the key thing is take your tablets regularly and participate in research. Remember, today's drug was yesterday's research. A lot of the research that is ongoing, you're not being used as a guinea pig. The stage of guinea pigging is past. Any research you're invited to take part in, you're not going to be used as a guinea pig. It's the stage at which your people are invited is the stage just to check if the drug actually works. The safety checks for the drug has actually been checked in other stages. We don't invite patients for those stages. We actually use certain types of select people that have already signed up as research participants. So if you're being invited for research, you're not being used as a guinea pig. What we're trying to determine is, does the drug actually work? So safety is usually not an issue at that time. So please be very mindful. But obviously, safety information is also obtained during that time as well. So if you're invited for research, do take part. Very, very important. So that's lupus. So I'm sure there'll be lots of questions on lupus, but I will respond to it after we've tackled fibromyalgia. Then we can sort of take it together. Now, what is fibromyalgia? Same format. How is it diagnosed? And what you as a patient need to know. So fibromyalgia can be called FM or FMS. It's a very, very common condition. For every 100 people in the UK, 4 people are affected. But it's a condition we've known about as far back as the 1900s. It used to be called fibrositis then, And you can see these yellow spots that are lighting up on the slide on your right refers to where people can struggle with pains related to fibromyalgia, but it can affect every part of the body. And people get what we call widespread pain. There can be pain everywhere: neck pain, shoulder pain, back pain, chest pain, pain in the center of the chest, hip pain, shin pain, calf pain, knee pain. Pain can be everywhere. So again, very, very important. So if you find that your pain is persistent for many, 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 many months, often up and down, not settling, you're struggling with tiredness and very, very poor sleep, your sleep isn't refreshing you, it's nice to get assessed. Could be fibromyalgia. Although it doesn't have a cure, there are strategies to make it better. So fibromyalgia is referred to as what we call a central pain syndrome. And as I mentioned earlier, it comes on with the baggage of pain everywhere, tiredness, and people just feeling really washed out, and the sleep doesn't refresh them. And it's a larger part of what we call a central sensitivity disorder. That just means the way in which you sense pain becomes very, very heightened. So if you're meant to be sensing pain at this level, you start to sense pain at a much higher level, and people really, really, really start to struggle with the pain symptoms that they have as a result of fibromyalgia. Again, it really affects a huge part of the UK population. About 4% of UK population is affected. There's common celebrities of people that have fibromyalgia. Lady Gaga, she has fibromyalgia. The African-American actor Morgan Freeman, he also has fibromyalgia. And the former American president JFK also has fibromyalgia. So it's a very, very common condition. Again, it's a condition that you need to have thought about to really diagnose it. And some people with fibromyalgia can have other problems. They can have depression, they can have OCD, they can have bipolar, where they are manic, really overactive sometimes, and then they are down in the dumps to the other. They can have PTSD, that's a bit of post-trauma stress. They can be very anxious or have panic attacks. So you need to have thought about it to really diagnose it to help these patients. So something you need to be very mindful of and you need to be aware of. And there's some overlapping syndromes that people can have in fibromyalgia. They can have tension headaches, they can have irritable bowel, they can have pain in the jaw, what we call TMJ issues. They can have bladder problems where they get an overactive bladder, where you get this burning urge to want to do a wee with joint pains. People can have problems with balance, they can have problems with consistent heartburn, they can struggle with concentration, so where people get forgetful, they have memory problems, people can struggle in that regard. Again, some women can complain of pain during intercourse, they complain of back pain. Then some people can have chest pain where it's constantly hurting in your chest. It's not a sign of heart attack, it could be something else. Now, what this suggests is that people with fibromyalgia can present to lots of specialties before seeing a rheumatologist. They can go to a gut doctor, they can go to an obstetrician, they can go to a blood doctor, they can go to all sorts of specialists. And it mimics what you find in that old Indian proverb of the 7 blind men touching an elephant. And one of them said, "Oh, it must be a rope," because he was holding on to the trunk of the elephant. One said, "Oh, an elephant must be a spear." He was holding on to the tusk of the elephant. He was a blind man. What did he know? One touched the ear of the elephant and said, "Oh, it must be a mat," because he was touching the ear of the elephant. One of the blind men touched the body of the elephant and said, "Oh, it must be a wall." But again, he was touching just the body of the elephant. One touched the tail of the elephant and he said, "Oh, the elephant must be a snake," because he was touching the tail. Again, you have to be quite mindful that various other specialists can call it all sorts of things. But when you see a rheumatologist who's actually telling the story, he knows how to tie it all together. So ultimately, if you have symptoms that your GP has not been able to tie together and you're struggling, just get your GP to refer you to a rheumatologist. I think that's the lesson, I would say. If there are unidentified symptoms that you've had for many, 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 many months, get your GP to refer you to a rheumatologist. Very, very important. Unfortunately, women are far more affected in fibromyalgia. We don't know why, but again, we think it perhaps has to do with hormone changes that they sometimes go through, particularly around age 40, 50. Again, that can be an issue. But pain everywhere is what people essentially struggle with. Now, I've seen some men with fibromyalgia, but we know that women are more likely to seek medical help compared to men. Men tend to just sit on things until it really escalates and becomes really bad. Understandably, they try and brave it out. which is not necessarily a good thing. But again, we know ultimately women are really more affected in this condition. Do genetics play a part in fibromyalgia? Perhaps, we're not sure, but we know that if there's a father or mother that has fibromyalgia, we know that the child may have fibromyalgia. Some people have argued that it has to do with a sort of mimicking of the parent's symptoms. We don't know for certain, but we know it can be a problem. We know that certain factors in the environment can play a part. So early childhood trauma can be a problem. So people that have gone through stressful life events, a bereavement, loss of a loved one, child abuse, again, that can be a problem. Physical or mental trauma, again, that can be a problem. Psychological stress or distress can be a big issue. Certain diseases, in fact, COVID, long COVID is essentially fibromyalgia caused by the coronavirus. So if there's anybody out there struggling with long COVID, essentially what you have looks like fibromyalgia, but it's been caused by the coronavirus. So again, it can be a problem. Of people that have survived massively catastrophic events, that can obviously cause fibromyalgia. So that's something to be aware of as well. It's a real diagnosis. Don't let anyone tell you that it's made up or it's in your head. That's nonsense. Fibromyalgia is a genuine, real diagnosis. In fact, this slide shows scans of the brain of people with fibromyalgia, and it shows what we call hotspots. So we know that the central organ affected in fibromyalgia is called the thalamus. The thalamus deep in the brain it's the organ that deals with pain responses, and it picks up pain on varying levels. So in people with fibromyalgia, if we did this sort of scan, we find that the thalamus is hot. It's just really, really hot because it's picking up pain at a phenomenally high level. So again, fibromyalgia is a real diagnosis. It's not made up. Don't let anyone tell you that. It's real diagnosis. It's not all in your head, it's real. So don't buy that for 1 second if someone's trying to sell that notion to you. Tell them they're speaking rubbish. So how is it diagnosed and treated? Again, it can be by anyone that knows what they're doing. Your GP can diagnose fibromyalgia, and your consultant or any other specialist can diagnose it. There's nothing mystical about the diagnosis of fibromyalgia. You just need someone that knows what they're talking about to tie it all together and to help you. But usually if you have what I call a triad of pain everywhere, tiredness that isn't getting better with sleep, and your sleep is not refreshing, that's usually the entry point to suggest fibromyalgia. If you're having poor concentration, you're getting forgetful, that's usually an early sign. IBS, your bowels are all over the place. That's usually a sign. Pins and needles in strange places, coming off and on. Again, that could be a sign. Usually the blood tests are fine, but sometimes the blood tests may not be fine. You just need someone to make the right interpretations of what they're looking at to be able to unpack it and untease what they're looking at. So very, very important. How do you treat it? Lifestyle adjustments is very, very important. And obviously, certain times I give medication. Ultimately, changing your lifestyle is important. And what do I mean by that? As an example, I had a school teacher years ago. Her work was really a form of stress for her. She was really struggling with fibromyalgia. So the work was a form of stress. She decided to start that business that she had yearned to start, quit her job, started her business, got a dog so that she could exercise and take the dog on walks, and she got better. So again, that's one example. Another example, I had a fitness instructor. She was really struggling with very bad disease, and she was already fit. She was a fitness instructor. And she said, look, what more do you want me to do? And I told her, change what you do. Instead of weights, mix it up. Start to do a bit of treadmill, exercise, biking, mix it up, rower exercises, mix it up. And she did, and she got better. So again, lifestyle modifications are very important. Lifestyle changes and adjustments are important. Now, stress is a huge issue. We can't take stress away. Stress is part and parcel of the human experience, but you can adjust how you cope with that stress. Take your breaks, take your holidays, take your downtime, and try and do something pleasurable. We know that it is actually more refreshing for you to do something pleasurable than for you to sit around doing nothing. So say, for example, if you haven't been to the cinema for a while, go to the cinema, call a friend, go to the cinema, get your popcorn, get a drink, go out, do something pleasurable. That's more relaxing than sitting around doing anything. So you're more likely to feel refreshed if you've done something pleasurable rather than sitting down, lying down in the bed saying, I'm just going to have a lazy day. No, you wake up feeling washed out and horrible and you don't feel quite great. So bear that in mind. But the most important thing is medication, if it's offered to you, may be an initial strategy. And when you're better, you can come off it. So nothing wrong with having a bit of medication to help you. But again, you can always discuss with your clinician and consultant and your GP on how they can help you. And obviously, things that have been a problem, if it's a stressful relationship, again, that's something you need to do something about. If it's isolation and you feel isolated and lonely, then you need to try and be more relational and do something about that. Again, if it's poor sleep, try and make sure that your sleep hygiene is better. Don't sleep with your phone, things like that. Turn your notification off. Get a night lamp so that you can switch the light off and pull the curtains, and you can get light blinding curtains that takes out light completely. So there are lots of things that you can do. It's all about making little adjustments and tweaks to your daily lifestyle. Again, some people find that taking a cup of cocoa at night helps them to sleep. It's actually not a bad strategy to help sleep, because it can be quite heavy when you take a hot cup of cocoa. Some people find it quite heavy. And once you get that sort of full tummy from it, then that actually helps. Some people get heartburn from that, so you have to be quite mindful. But there are lots of things that you can do. Sometimes when my patients complain of sleep, I tell them, get a language book. If you've always wanted to learn a language, get a language book that you've always wanted to learn. Get a night lamp that is timed, so it turns itself off, and read it. You are likely to fall asleep in next to no time. So these are small strategies and adjustments you can do to make a difference to your life. But ultimately, the treatment is exercise, graded exercise. Now, this doesn't mean go crazy with exercise. You can do exercises like swimming, exercise biking, aqua aerobics, Tai Chi, Pilates, spin. That's very, very important. And it's the consistency of the exercise that makes a difference. So consistency is key. Even if you are doing exercises 10 minutes every day, you are much better off than someone doing 1 hour a week and nothing else for the rest of the day. So 10 minutes consistently is key. It's the consistency that makes a difference. Start low, go slow, and build it up. You know what they say, you're better off being a very fat person taking little steps than a thin person sitting on the couch. Very important. That fat person taking little steps is going to become fit and a lot thinner later on. The fat person sitting on the couch is going to get fatter. I'm sure you've all seen that social media picture of as our television sets are getting slimmer, we're getting fatter. So our TV sets are getting slimmer and we're getting fatter. Whereas in the good old days, the television sets used to be very chunky and big, and everyone used to be so trim and slim. But now it's the reverse. So bear that in mind. Certain drugs do make a difference. Things like amitriptyline, nortriptyline, duloxetine, pregabalin, gabapentin. I use a lot of these drugs, but you can have that discussion with your consultant or GP and see what works best for you. And you might be invited to attend a pain management course. Take it on board, engage. Those that take ownership are the ones that actually get better. So do bear that in mind. Very, very important. And what do you need to know? It's a real diagnosis. It's not made up. You just need to take ownership. Don't let people put strange ideas in your head. Ownership is key. And it can be quite up and down in how it presents. But you, the patient, you are the key. You are the key person in this story. So it's really down to you. What you put in is what you get out. But the key message, if you don't remember anything, remember this. Little as often as much as you can. Consistency is key. Very important. I tend to put this slide up on COVID vaccinations on you. I know there's a lot of controversy with vaccinations and a lot of suspiciousness, especially particularly amongst the African and Afro-Caribbean community, where people say all sorts of strange things like market beast and all that nonsense. It's not true. Just take your vaccinations, okay? This is proper science. Take your vaccinations and it shouldn't be a problem. And you can ask me anything, but thanks for your attention, everyone. And I'll see you in the comments and questions.
Thank you so much. That was such a great overview. And from the very beginning, I was learning. So I was shocked, actually. I didn't realize lupus was wolf. I should have known that. But I was learning from that point. And for me, one of the things was about people having the fact that you will go to different specialists and they only see one part of you, and it's about connecting it all together. So for people to understand that, and so then, but don't be dismayed, but keep on fighting to fight the right person that will bring it all together and give you the care that you need. And I'm sure we're going to talk about this again, but I loved how you talked about long COVID and being, you know, the fibromyalgia of COVID, because I think that very much like fibromyalgia, long COVID isn't really well understood, and for some it's really dismissed. So thank you so much there. So we've got questions as always coming in thick and fast, so I'm going to pick some of them. Please continue to send them through. If you're on Facebook, put it on there. My colleagues will pick that up, and bear with me because I have got a cold, so I can feel myself sounding bunged up. But so one of the questions is about vitamins, and which vitamins they should take.
Okay, yeah, I think Vanessa has a bit of a cough, so bear with that. Yes, so vitamins. Now, vitamin D is very good. You can get vitamin D over the counter. You don't need your GP to prescribe it. For those of you that have done a bit of exploration on this, 400 international units, 400 to 800 is fine. So if you go to Sainsbury, Tesco, any of the shops, 400 to 800 is fine. It can be 1 or 2 tablets, that's fine. And if you're dealing in terms of the grammage, 25 to 50 micrograms is fine. So vitamin D, you can get over the counter, and it's good for bone health. Now, other vitamins like C, A, and the rest of it, you can get it in diet. So I'm not really a big fan of supplements in that regard. But vitamin D, because the human body doesn't make enough of it, and we're meant to get it from sunlight. And you know that black skin doesn't really produce vitamin D properly because of the pigments. Our pigment melanin doesn't allow us to do that properly. So taking vitamin D from over the counter is absolutely fine. And that's pretty much it. Some people like to take a bit of cod liver oil or something. That's okay. But remember, if your supplement is costing an arm and a leg, I don't really think it's worth it. So yeah, that's my view on supplements.
Thank you. I think your point about the supplements being an arm and a leg, and people, I always feel my mum has fallen into that trap. She's on every vitamin under the sun and is bringing the whole concoction, and you wonder where, you know, what's driving that, where she's gotten that education from. So it's I'm glad you said that. The next question was just about the blood test to identify lupus. You touched on it, but would you be able to explain to people, because I'm sure they will, oh sorry, my video's off, they will hear from their doctors about different blood tests. If you could go over that for people.
Yeah, sure. Thanks for that. Now, like I said, you shouldn't use one blood test to just diagnose lupus, mainly because you have to remember the way to think about blood tests are like, let me give you a way to understand it. Blood tests are like height or weight. Let me use height as an example. What do I mean by that? Lots of people will have average height. So you've done a blood test, your readings might fall into the average category. Now, when it comes to height, there are some people that are tall, but they're not abnormal. So if you have a tall blood test, it doesn't necessarily mean it's abnormal. It's just a tall blood test. Conversely, if you have a short blood test, it doesn't mean it's abnormal. Like height is just a short person. But when it comes to height, you can have a giant. Aha, that's a problem. So if you have a giant blood test, that's a problem. Or if you have a little person, that's abnormal. So if you have a very little person type blood test, that's abnormal. The point I'm trying to make is your blood tests have to be interpreted by a specialist that knows what they're doing. And this could be your GP. If your GP is happy with the interpretation, that's okay. There are certain types of proteins we like in lupus, but just because you have the protein doesn't mean it's lupus. You have to take it into account with symptoms. Now, I always say when it comes to lupus, lupus doesn't sit on the fence. If you have lupus, you will know about it. It will cause problems. And I've given Selena Gomez, the singer, as an example. She lost her kidneys. You have to understand, with all the money in the world, she lost her kidneys. That's a big deal. If we think about Seal, the musician, with all the money in the world, obviously when he had it, he didn't have money. his face got disfigured. So lupus doesn't sit on the fence. So if it's lupus, it will let you know about it. That's what I always say. So don't panic, see a specialist, and it could be your GP that can tie it all together to make sense of it. And if anyone can't make sense of it, make sure you see a rheumatologist then.
Thank you. Oh, I think you really articulated that so well, and that whole aspect of if it is lupus, it will tell you it's lupus. I think that's something that's going to be ringing in my mind a lot.
Sure.
So the next question is, can you say a bit more about the link between sunlight and lupus? Because this person's written that there's a lot about sunlight and the male rash, but not much else. So how does sunlight affect SLE? Can it result in headaches and joint aches, for example?
Yeah, that's an excellent question. I love that question. So let me try and de-geek that question. Let me not ask, I don't want to answer in a very geeky way. So I hate to throw big words about, because I don't think you're clever if you throw big words about. Actually, you're very dumb when you do. I think the beauty of someone like Einstein is he was able to explain complex things in very simple terms. That truly shows you're actually clever when you do that. So this is what happens. Ultraviolet light, sunlight, is divided into two parts. There's A and B. B is the bad part that affects lupus. A causes aging. That's what gives people wrinkles and the rest of it. So it's easy to remember. A, aging, B, bad. Now, when you absorb all that ultraviolet B rays, it goes into your skin, damages the cells. Because you already have a template for lupus, the damaged cells, the body sees it as foreign, but it's an exaggerated response. The body sees it as foreign, and it's so exaggerated. It's like using a bazooka to kill a cockroach. So the body essentially uses a bazooka to kill the cockroach, and then you get the skin rash and problems. And because you get lots of damage, the whole body just rounds up the troops and then causes damage. That's the way to think about it. Very simplistic, but that's really the general sense of what happens with sunlight. But when you use your SPF 50, and there are lots of products you can get in the market, there's SunSense. Some hospitals can give you on prescription, or you can get it over the counter. It's called SunSense. That's Sun, S-U-N, Sense, S-E-N-S-E. Slap it on, wear a big hat. If you're going on holiday, get your nice big hat to shield you from the sun. Slap on your sunscreen anytime you go out. Slap it on, be generous, black skin or not. And that's very, very important. And make sure you wear clothing that covers you up, so you don't get that sun damage from the sun. That's the way to think about it.
Perfect. Thank you so much. Someone else has just written a statement, but I think it's good to reflect on, particularly because they've said that menopause can be a trigger. And we're hearing more and more about menopause, which is great. But it'll be great to hear more about it from your reflections.
Excellent question. Now, remember that typically people that get lupus are in the childbearing age. So once you start to hit menopause, I start to breathe a bit easier about lupus being an issue. It tends to be more with women of childbearing age. And the reason is because it has to do with the sex hormones. The sex hormones, we know they're implicated in really causing issues with lupus. And as you have less and less of estrogen, that becomes less of a problem. Now, we know that with menopause, you tend to get certain hormone triggers, but lupus would be less of a worry for me at that stage, but it can still happen. But it's important to get yourself assessed, just to be absolutely certain that if it's lupus you're concerned about, make sure you get yourself assessed to be sure that it isn't. But I wouldn't worry as much when I start to hit menopause, because that actually, to a large extent, makes lupus a bit rare in that age group. It's usually childbearing age 15 to 44. So those are the key age, and it has to do with the sex hormones. That's why we worry about lupus during the childbearing.
Perfect. Thank you so much. As we expected, questions are coming in thick and fast. I'll up my pace. So what if you get joint pain but no swelling?
Yeah, so you can get joint pains without swelling. Now, when you get joint pain without swelling, that actually tells you about the severity. That means we don't tend to worry as much. Now, it doesn't mean you don't have disease, but it just means that you can worry less about consequence, that whatever you have will cause damage internally. But whatever joint pain you have, you need to get it assessed. Very, very important. The reason why I say that is having joint pains is not normal, but I was telling a patient once that anytime you're over the age of 40, that's me and lots of us, perhaps included on this platform today. Once you're over the age of 40, it's our God-given right to have pains. That's just the way it is. Somebody said, God only promised 10. Anything else is aches and pains. But it is important that if you're getting pains in your hand joints in particular, the small joints of the hands, that's usually a problem. You need to have that checked. But if you have swelling with your joint pains, which is why I said it's important you take photos of it, particularly in your hands, you can't make a fist. That's a problem. That's a big problem. You need to have that assessed by your GP as soon as possible. It may not be lupus, it may be something else, but generally that's a bad thing. And remember that people with fibromyalgia have pains. You can have pains because of fibromyalgia. Again, it's probably important to speak to your clinician to guide you on what to do. But ultimately, recovery has to be paced by you, the patient, because we're all adults. You can't tell people how to run their life. You hold the key. You have to guide yourself with the information you're given, and then work your way throughout. The Versus Arthritis website is one I find useful. Versus Arthritis. Let me put it in the chat. Versus Arthritis website. If you need more information on any of these conditions I've talked about, then go to the Versus Arthritis website. It's a charity that deals with all sorts of joint issues. It's a very, very useful website with lots of rich information. So if you want information, just search lupus versus arthritis. It will give you a lupus booklet. If you want information on fibromyalgia, just say fibromyalgia versus arthritis. If you want information on osteoarthritis, type osteoarthritis versus arthritis, and it will give you information all on Google. Okay, so please do that.
That's great. Thank you so much. And I've got some people that are talking about their kind of personal scenarios, and I'll come on to that. There's questions about new advances on the lupus drugs. Someone says they take mycophenolate and hydroxychloroquine. Are there any new advances in the lupus market?
Yeah, fantastic question, Vanessa. Thank you. Hydroxychloroquine, I'm a big fan of hydroxychloroquine. I mean, there used to be this professor that would say, if he could, hydroxychloroquine needs to be in the water of everyone taking lupus. I mean, everyone that has lupus, it needs to be in the water supply. Hydroxychloroquine is absolutely key. You should be on your hydroxy. Why? Because it calms the immune system down. It's one of those drugs that I know was made popular by Donald Trump because it was taken to prevent COVID. But it's a very, very key drug in lupus. It works by calming the immune system down. So all the overactiveness, the ravaging, rampaging disaster the immune system is causing, hydroxy calms that down. Mycophenolate also works, but there are other therapies that you can have if you qualify. Remember, mycophenolate, we've used it as far back as the 50s. So the newer therapies we've not used it for too long, but they work. You need to probably liaise with your consultant to see if the drug you're on is the best for you. Mainly because everyone's lupus is different, you see. So I can't really make sweeping statements, but yes, mycophenolate is fantastic. Some people might be on methotrexate, some people might be on azathioprine, some people might be on rituximab, some people might be on belimumab. That's fine. All of these therapies have to be judged based on what you, the patient, needs. Because there are patients of mine with lupus that are only taking hydroxychloroquine, and that's fine for them. And there are some that have had a drug called cyclophosphamide, they're on belimumab, that had both. That may be fine for them. So you have to decide what's best, and your clinician will guide you on that path.
Perfect, thank you. And there's a question that's come up, which it's interesting in my work within sexual and reproductive health, has come up previously about should you avoid having children if you have fibromyalgia?
No, in fact, I never try to. I think it's very silly for clinicians to make that restriction on anyone. Don't restrict people's life for what they need to do. If someone wants to start a family, guide them to start a family. You can't make these sweeping statements. I always shudder at my colleagues that make these sweeping statements that don't do this. How dare you say that? I mean, anyone can do whatever they want. But here's the thing: if your lupus is not controlled, then it's usually not a good idea to have children. I mean, there are still people that have done it, but we always worry because if your lupus is not controlled and you're having a child or you get pregnant, the worry is we are limited in what we can give you safely. I mean, there are times we've given therapy to women that are pregnant, but it's very risky to both mother and baby. So you have to be very careful. But if you have fibromyalgia, you can get pregnant, you can start a family, you can do whatever you want. In all fairness, you can do whatever you want. No one can restrict you. No one has a right to restrict your plans for life because, again, you can do whatever you want, but do it in conjunction with your consultant. Be guided by your consultant, but ultimately, we can't tell you what to do. Remember, consultants are just your guide at the side, not the sage at the stage, so that you don't shrug at our drug. That's the way to think about it.
Love it. Thank you. So I'm just going to start some of the scenarios. So someone reports that their friend died, and I'm sorry to hear this, age 45, and they said it was lupus. She went into hospital with breathing difficulties, and they wanted to discharge her, and she said no, and died the next day. And she remembers as children, her face would flare up in the summer and she sniveled a lot. Could she have had lupus at that age without knowing?
Yeah, thanks, Vanessa. That's an excellent question. Now, just very quickly, someone's asking a question about they are on methotrexate and hydroxy and they don't have lupus. Remember, all these drugs, hydroxy, methotrexate, we use it for other conditions. So if you don't have lupus and you're on these drugs, don't panic. We use it for lots of other conditions that affect the immune system. The problem is drugs that affect the immune system, a lot of these drugs we use for lupus and other things treat the same condition. So it's okay. Now, for this lady that died at age 45, sorry to hear about that, by the way. It's sad. I mean, it could have been anything. It could have been blood clots. It could have been anything. But the message is, and what I want you to really take away is, if you're not feeling 100%, keep a log of your symptoms. Take photos of things you have seen. Keep a log of symptoms. You are doing your GP a great help and your consultant a great help when you keep a file, a log of what's been happening to you. It's very easy for you to see your clinician and say, do you know what? I have had XYZ, ABC. It's very easy. It makes you very focused and targeted. And based on that, your clinician might say, okay, something's up here. Let's do something about it. So that friend that sadly died at 45, and I'm sorry to hear that again, it can be anything. It could have been anything. It could have been heart-related. It could have been a blood clot. It could have been a heart attack. It can be anything. Because the most important thing is, if you're feeling less than 100%, get yourself assessed.
Thank you. I think also there's something about just reading through the questions that are coming through Facebook. There's something about, I think, lupus being quite dynamic, changing, and then how doctors manage it changes. And I think that can be confusing for some people. So just as an example, one of the things was, why do doctors change the requirements for lupus every few years? I was diagnosed with lupus at age 14, and now that's been taken away and they're testing me for other things, but not lupus. So I think the diagnostic criteria, but also how it's managed is changing. So I don't know if you can comment on that, even though you don't know this specific case.
Yeah, but that's a very good question, and I like the person that as sort of answered as asked that question. Now, what you need to understand is the human body is dynamic. We're not static creatures. We're constantly dynamic. So what that means is, just because when you were younger, your immune system was overwhelmed and you had lupus with typical blood tests, typical problems with speeches. As you get older, remember, your immune system is always trying to repair itself. Your immune system is always trying to do the best it can. It is possible that at this stage of your journey, a lot of the things you had in the past, you've lost them. And that's a good thing. You know, that really is a good thing. There are people that go into what we call remission. There are people with lupus that stop taking their medication because they are better and they don't need it. Usually I have a discussion with my patients and we decide if we need to go in that direction. Then we say that your lupus has gone into remission. That is rare, but it's possible. So just because you've had a label taken away from you doesn't necessarily mean it's a bad thing. It may be that at this stage in your journey, your lupus is less of an issue. And that's a good thing. Do you know? That's really a good thing. What I would suggest is, if someone like you is invited for research, do participate so we can know what in your genetic makeup is making you less prone. So that's very, very important. So that would be the key message I want you to take away. It is possible that something in your genetic makeup has made your disease less intense. So do bear that in mind, please.
That's really helpful. I think that's a really good way to frame it for many people listening. And I'm sure it's not just about lupus, it's other medical things as well. We change, we evolve. Vitamin D, do we still need to take it between April and September? Someone has said that they've been told they don't have to.
No, you can take vitamin D anytime you want. In fact, remember, we need vitamin D. If you're on a daily tablet, take a daily tablet. That it's a myth about April and no, don't worry about, just take vitamin D. If you need vitamin D, take vitamin D. And if you want to get plenty of sun, and this is for people that don't have lupus, obviously, and even if you have lupus, you just put on your sunscreen. It has to be between 10 a.m. and about 2 p.m. That's because that's when the sun is highest at its peak. So you want to get like maximum therapy. Yeah, but that myth about not taking vitamin D on a certain month of the year is irrelevant. Take vitamin D whenever you want, okay? You're absolutely fine. The reason why you're told not to take it between April and September is because the assumption is it's summer and you don't need it. But if you're covered up and you work in an office, you need your vitamin D, don't you? Remember, the logic is, in the past, it used to be thought that because of summer, you don't need to take vitamin D. But now a lot of us work inside of offices, so you need your vitamin D when you need to take your vitamin D. So it's fine to take your vitamin D. When you stick to the right doses, that's 400, 800 daily, that's 1 or 2 tablets, you can't really overdose on vitamin D. Although I have to say there are certain conditions which you might be told not to take vitamin D, but again, your GP or consultant would have told you what conditions those are. But vitamin D is generally safe. It's good for bone health, it's fine, which is why it's an over-the-counter drug. So don't panic, if you need it, take it.
Great, thank you so much. The next question was, again, a personal one, but actually before that, I'll go on to about lupus affecting the eyes. Can it do that? Can it cause things like macular degeneration? Someone has written.
Yes, I mean, lupus can affect the eyes, but it's very rare for it to affect the eyes. So macular degeneration, if you have issues with what we call macular degeneration, that just means the back of the eye sort of not being efficient in how it picks up the light and transmits it to the brain. That's not lupus. Let's be clear, that's not lupus. Lupus can affect the eyes, but it's rare. It's very, very rare. So if somebody comes, if I'm being told that there's a lady with eye issues and it's lupus, then I'm always very doubtful, because there are other ways that lupus can affect the body, not necessarily with the eyes. So you have to be very careful to make that distinction. But the issue is, because it can affect lots of organs, they usually come as a baggage. You can't have one thing in lupus. It won't just be joints and nothing else. It will be joints and skin, joints and tissue, joints and kidney. It's usually a combination of issues. So please do bear that in mind. And I think somebody's asking about re-emphasizing health messages and social media. Now, remember that people are obsessed with followership on social media. So they will say anything to get followers. So people practically lie about disease day in, day out. And the amount of times, I mean, I can tell you one. There's a lady I saw when I was training, and she came up and told me she had disease, and she didn't have it. Just read it on the internet and said, I have this disease, and she ran with it for many years. So people do that. It's just the way it is. You have to be careful. If somebody comes on social media and starts to tell you about how the vegetables and herbs has cured a disease, be very doubtful. I always tell my patients, the happy patients that are living full and free lives don't have time to moan on social media. They're going on holiday, they're having children, they have businesses, they're not bothered. It's the ones on social media telling you how miserable life is and they want your life to be miserable. They're the ones that have time. Be very careful. Be very, very careful of those ones. Be very, very careful.
I couldn't agree more. Another personal scenario is that someone has said that their protein test came back as high a few times. She was referred and told she was too well for lupus, but it was put down to fibromyalgia. And so they just wanted to know why it's so close to lupus and what are the main meds to combat continuous pain that she feels.
Yeah, so obviously that can happen. Remember, not just one blood test causes lupus. Or you can't say you have this blood test, you have lupus. It's a bit of a wrong way to practice medicine. You have to take everything into account. And when I say everything, if you think the animal is a zebra, it has to look like a zebra, jump like a zebra, sound like a zebra, have stripes like a zebra, then you call it a zebra. Just because it's black and white doesn't make it a zebra. If it's black and white, it could be a panda. So you have to be quite careful. So just one blood test is not enough. And it's possible that if you have joint pains and your lupus test is off, it doesn't mean it's lupus, but it could be something else. Joint pains is not normal. There's usually a reason. Remember that. It could be fibromyalgia. It could be osteoarthritis, wear and tear. See your GP to talk about it. And if your GP isn't sure, see a rheumatologist. But joint pains isn't normal. There's something. It could be osteoarthritis, which is wear and tear. That will affect every one of us. So your joint pains has a reason. You just need to find that reason, and your specialist or GP can give you the reason for it. And remember, all of us will have aches and pains. It's just the nature of the world we live in. I always say that's what we signed up for. Again, and a funny way to look at it is 70 is only what God has promised. The rest is aches and pains. And it is true. It's truly aches and pains. But there you go.
Fantastic. And circling back to sunlight again, someone has asked me specifically if sunlight causes joint ache and headaches, or does it just cause the malar rash?
Now, for lupus, sunlight can cause a flare, and it can cause your lupus to really act up. And it can, for people with the template for lupus, it can cause them to have lupus. But sunlight generally is good. And when I say sunlight generally is good, that's for people that don't have lupus, obviously. If you have a flu, you feel run down, you're in bright sunlight, you just feel better, fresh air. You just say, do you know what? I feel great. Or if you have hay fever, you probably hate the pollen that you get with summer. But the message is the sunlight can trigger anything related to lupus, not just skin issues, but anything. Obviously, the skin issue starts it off, then you can get anything else. But just put on your sunscreen. You still need your the beneficial effects of sunlight. So put on your SPF 50 minimum, put on your big hat, and enjoy the sun. You shouldn't avoid it altogether, but you need to be in a shade. That's the key message. You need to be shaded up, protected up, so that you're not a hermit and you don't feel horrible. Because ultimately, I'm not advocating because you have lupus, lock yourself in a room and be miserable. No, go out, but protect yourself. Nice big hat, sunshades, SPF 50, close yourself up, shaded place, nice canopy, and enjoy the sun, enjoy the warmth of the sun, but don't let the sun directly burn you to death. That's what I'm saying you should avoid. That's great, because someone else has just added what precautions today should be taking in the summer season, and you've answered that beautifully. Thank you. So someone else has written, my lupus was diagnosed when I had swollen glands that wouldn't go away. I was sent to the hospital for tests, but they weren't sure of the cause, as I didn't have any other symptoms other than my eyes and lip swelling. I didn't start suffering with flares until 3 years after. I think this person just wants to say to emphasize people and emphasize what you said about listening to your body, and that it takes time for these things to evolve. Dr. Kelly, I don't know, have you frozen? I think Dr. Kenny has frozen.
Yeah, he's frozen, I think.
Yeah, so I think I'm just going to poise us for the next question, and then I'm sure he'll come back on. But I think the next questions were really about hormones and lupus and fibromyalgia. So one of them was, is there a way to reduce your estrogen level to lessen the impact of lupus? And someone is talking about HRT and lupus and fibromyalgia. So if you give us a second, I'm sure Dr. Kenny will be, here he is.
He's back in there.
He's back.
Yeah.
Because I don't have the answers to these questions, so I could sing or something, but rather than.
Okay, sorry. I think it logged me out. Sorry, like I got pushed out.
No. Sorry, I was just saying that I wouldn't be able to answer any of the questions. I could probably just sing or something like that. Not with my voice as it is now. But we're great to have you back. And there are some questions about estrogen levels, and again about menopause and HRT. So one of the questions was, is there a way to reduce your estrogen level to lessen the impact of lupus? And then the other one was fibromyalgia and menopause and HRT, and what's the best way of managing that together?
Yeah, so thanks. I'm sorry about the being logged out. I actually thought Vanessa had frozen up. I didn't know that I had been ejected. Okay, right. I didn't know I'd been ejected out of Zoom. So just to mention, you don't need to drop down your estrogen levels. Estrogen, you should embrace it. You're feminine, you're female. Enjoy your estrogen levels. Embrace it. Enjoy it. Now, the issue is it's how to cope and manage the levels. That's essentially what it is. If you're having symptoms of pain, the key thing is to address the pain. So it's not necessarily trying to switch off your estrogen, because remember, it's the estrogen that gives you your feminine nature, that gives you that feminine appeal. It's a good thing, embrace it. It's having to adjust to the pain that's the problem. Now, for those that are having menopause that are in pain, all you need to do is the pain needs to be managed with the menopause. Obviously, the menopause, if you need HRT, then your GP will give you HRT if you need it. But you can try remedies that actually help. Things like primrose evening oil. I don't mind that helps, primrose oil. Supplements that help with menopause to help you cope a bit better. I don't mind that, because those supplements do help people. But remember, if your supplement is costing an arm and a leg, then I will avoid it. But if it's helping, then that's fine. I don't mind supplements that help with menopause to allow you to adjust. But ultimately, if you are in pain, with swelling or not, you need to make sure you are telling your GP, take photos to log it down and see a specialist. That would be the advice.
Thank you so much. And one of this is someone with lupus says that they suffer with, I think it's antiphospholipid syndrome, which affects their blood clotting. They're on warfarin and their range is 3 to 4, but struggles to stay in range. Is there any advice that you can help with this, knowing that you're not a hematologist, but if there's anything that could be, you could give support? And we always emphasize that you're not someone's individual doctor, you're just giving broad advice.
Sure, I'm giving broad advice. And that's an excellent question. Obviously, we look after people with APS or APLS as well, in conjunction with the blood doctors. We do that, so I understand what they're talking about. But here's the issue. The reason for your not being in range could be because you're taking a supplement that is interfering with your being in range. So that's something that you might want to look at. It could be that one of the drugs you're taking or supplements, something you're doing, might be interfering, and it may not be. Oftentimes, I know that it can be a struggle with warfarin, but you can have that discussion with your blood doctor if you need to be changed to one of the newer agents. Although it's not the best for APS, but you may want to have a chat with your hematologist to see if they can give you as an add-on or as a replacement, particularly if you've not had clots for a while. But that's a discussion you can have with your specialist, and you can look at your drug inventory and see if there's a supplement you're taking or something you've added that might be interfering. It could be something as simple as an anti-acid tablet interfering with your range or something. So have a look at your drugs and check that there isn't something interfering. Usually there's a drug that's interfering. And in my experience, it tends to be an anti-acid tablet. If you're taking like omeprazole or those kind of drugs, it might be interfering. So have a look at it and do a bit of detective work with your blood doctor.
Perfect. So as ever, we have come to the end of the session. It always goes so quickly. I'm sure maybe not for yourself, but for us listening, you gave such a fantastic presentation and have given such thorough answers to everyone. So on behalf of everyone, just want to say a huge thank you. And I also urge people to go on the website that Dr. Kenny put on there, Versus Arthritis. And I think it's really lovely to end on one of the comments that you received, the saying that you're a great teacher and you've given examples that are relational and which one can relate with. So kudos to you. And I'd really want to echo that. I think you give such great examples for people to really understand, which can be a really complex area, but also really distressing as well. So thank you so much. Again, thank you to all of you that have come on. We never take it lightly on a Saturday morning when you could be shopping, cleaning, sorting out life, sleeping, having a lie-in, that you do. But you've chosen to listen and come on to here. So thank you so much. And we look forward to seeing you again next week. And I'm going to hand over to my colleagues at CAHN for any announcements. Dr. Kenny, thank you again so much.
Thank you, everyone. Thanks for having me, and it's my absolute pleasure. Remember, stay healthy, and yes, look after yourselves. Don't be a hero. If you don't feel 100%, see your GP and get referred if you need to.
God bless you for a good morning.
Goodbye.
Thank you.
Dr. Vanessa, Dr. Kenny, thank you so much. It's James from CAHN here, closing out the session. Another amazing session with some really interesting information, some really interesting kind of anecdotes, and some great value and information passed on to the community. So thank you again from the CAHN team and the CAHN staff. Particularly some of that advice, very well directed advice around kind of being wary of social media influences. Yeah, absolutely. So what I wanted just to cover, thanks for the first slide, Angela, is just to let you know that CAHN Health Hour is on next week. What we'd like you to do is to stay tuned to our social media platforms to find out the topic for next week. As ever, the session is from 11 to 12:15. You can expect the same type of rich, dynamic information from our professionals and from our hosts, talking and conversation around some of those really critical issues that affect, kind of our communities up and down the country. To register, just as ever, click on our website or email us at event@cahn.org.uk. Next slide, please, Angela. And of course, every single week we have our Healthy Hearts session, and that's on Tuesday from 6 p.m. to 7:30 p.m. Be fantastic for as many of you to join us on that. As you can see on the slide there, we led by our physical instructor, Orlando. Again, same thing. Please come along, come and join. Check our social media for the link. But to register or to find out more information about the Healthy Hearts and Nutritional Challenge program, please just email us at events@cahn.org.uk. Next slide, please, Angela. And as you can probably see from that very brief glimpse that you had of me today, we're in the Alexandra Park for our Windrush 2022 event day today. I can tell you that the weather out here is fantastic. It's a little bit windy, but it's incredibly sunny, and the park is starting to fill up. People are starting to come around the stalls. All of our stall holders are here. The performances are on. So do come and join us. It's going to be a really special day. Some really good fun. We get to give some great information out, connect, and have an enjoyable afternoon together in the park. Alexandra Park in Manchester, from 12 until 6 p.m. Do pop along if you have the chance. It's going to be a really great day. And I think, by the looks of things, the weather is going to. Next slide, please, Angela. Yeah, and finally, just to say to all of those people that have been accessing and joining us, be it on Facebook, on YouTube, or via the Zoom session today, as ever, please get in touch. We have a series of a range of different services and a series of different programs that we provide, be it family support, domestic violence and advocacy. Our counselling service, of course, is a critical service for people across the country. You can call us at any point in time. The telephone number for clarity is 077 10 022 382. And you can always email us if that is a more convenient or more safe way for you to access our help and support at help@cahn.org.uk. As I said, finally, last quick mention, CAHN Health Hour is going to be on the same time next week. Join us next week between 11 and 12:15. Follow us on our social media for the details of that session. But once again, thank you, a massive thank you to Dr. Vanessa and Dr. Kenny for a fantastic session, really informative. Thank you all for joining again today. Please tell your friends and family about the sessions and ask them to join. We'll build the momentum and get that information out to the community. Thank you ever so much, everybody, and good afternoon.
Blessings. God bless.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.